Hi everyone, I hope you're having a great day out there. Everything is wonderful here in Aronowitzland. I just wanted to share with you a few thoughts about sunscreen, sun protection, that sort of thing. It's the middle of the summer here and it's a good time to do a little refresher. So you may have seen our Instagram post, a man whose picture was published in the New England Journal about 10, 12 years ago. It's really an old story, but he has a lot of sun damage on one side, marked wrinkles, roughness, hyperpigmentation of the skin, etc. And on the other side, where he didn't get much sun exposure, he has a lot softer skin, very few wrinkles, and very little sun damage. And it's a good example of just what chronic sun exposure can do. But we really don't need to read the New England Journal of Medicine to see what sun does to damage our skin. If you just hop in the shower, you'll see this V here in your neck where it's usually exposed in men and women in the course of the day. And if you compare that to a little further down on your chest where you're really not getting much sun exposure typically because it's covered by clothing 99% of the time, you'll see that there's very little sun damage. And although the skin still ages, it ages in a much less accelerated way than the parts that are exposed. So sun obviously has a lot of different forms of energy within it along what's called the electromagnetic spectrum. So that goes from very intense cosmic rays, gamma rays, X-rays. These are rays that are mostly filtered out before they get down to us, but they still do get down to us and they can be very damaging. All the way down to visible light. But in between there is a little narrow band called ultraviolet light. And those rays are damaging to the sun. We don't really see them, but they can still damage our skin just like the more energetic cosmic rays and gamma rays and all of those. So those are the rays that typically are what causes burning of the skin, causes sun damage, which results in premature aging changes and even skin cancers. And they're divided up into ultraviolet A and ultraviolet B, UVA, UVB. And sunscreens and clothing that protect from the sun are called broad spectrum. Broad spectrum sunscreens protect from both the UVA rays and UVB rays. So that's why they just named them broad spectrum. Another thing that's helpful to know about the rays of the sun are that it varies depending on the time of day and the latitude we're at, obviously. So in the winter above the Arctic Circle in Finland, you're going to get a lot less intensity of the sun than you will in the middle of the summer in Phoenix, for example. And that's just common sense. We feel that on our skin. But also in the course of the day in the same location at 8 o'clock in the morning, for example, you're going to get maybe 20% of the energy of the sun that you would get at, let's say, noon. So if you limit the time between 10 and 2 that you're exposed in the sun, then that's an easy way to limit your sun exposure overall. And one final thought about sun exposure, and that is this concept that it's cumulative. In other words, it accumulates over the course of our whole lifetime, the same as X-rays. If we get X-rays once a week, all those X-rays accumulate. And they add up at the end of a lifetime, and there's a limit to how much your body can tolerate. And it's the same with sun rays. They add up as well. So we want to limit the overall exposure in the course of a lifetime. Now let's talk about sunscreens. So with sunscreens, they're graded by the FDA if they purport to have sun protective characteristics, and the FDA invented a term SPF, sun protective factor. And this is simply a number similar to what the EPA gives to your car. If you buy a new car, the mileage that the EPA gives, it's kind of an invented number. It's a good way to compare one to the other because all of the sunscreens are tested in the same way under the same conditions, but it doesn't relate to the real world actual efficacy of a particular product very well. For example, if you have a sunscreen that's rated 15, that doesn't give you 15 hours of protection. That just gives you, under ideal conditions, 1/15 of the sun exposure for that limited amount of time that it's tested, and under those ideal conditions. So you shouldn't look at a sunscreen and say, oh, I've got an SPF 18 and think I can be out in the sun for 18 hours. It's just not true. And it also doesn't mean that a sunscreen that is 20 is twice as good as a sunscreen that has an SPF of 10. That's really not how it works either. It's just a general number, and you should use it only as a general guide, not to hang your hat on, so to speak. Any sunscreen needs to be reapplied every 2 hours, give or take, but certainly not every 4 to 6 hours, close to every 2 hours for almost any sunscreen. Also, it's good to know that there are basically two kinds of sunscreens. And that's not the cheap and the expensive. The quality of the sunscreen, I don't think, really correlates very well with what you spend on them. What it really means is that the two types, in my mind, are the kind that are mechanical, that are mineral-based. So something that has a fleck of metal in it, titanium, aluminum, zinc in the ingredients. When you pick it up and you read the ingredients, that has a little fleck of that particular metal in it. And that's a mechanical block, and that metal fleck can reflect light all day long. It's not going to age out or time out by how long it's in the sun. As long as it's on there, it's working. The other type of sunscreen is a sunscreen that has a long chemical name that you can't pronounce and you don't recognize, and those are chemical-based sunscreens. What happens with those is the ray of the sun hits that chemical, and then that chemical absorbs the light, absorbs that energy, and then it basically converts it. And it doesn't convert back automatically. So after that sunscreen's been used, it really is used up. And although under ideal FDA laboratory conditions, it may have an SPF of 15, it really doesn't mean that it has that SPF of 15 in terms of protecting you from the energy of the sun for very long. So sunscreens that are clear, that have a chemical name in them that you can't pronounce and you don't recognize any mineral or metal name in them, I would say are marginally effective, generally speaking. They have a good characteristic in that they are clear and they can be prepared in a way that isn't as pasty as the mineral-based sunscreens, but you're also giving up a lot in terms of the effectiveness of that sunscreen. The other issue is that we now have reports that some of those chemicals have been shown to be absorbed through the skin with chronic use. And although there's not good evidence they cause any harm, I don't think there's anybody out there really looking at that question. So it is a question. They certainly shouldn't be used on small children. The mineral-based sunscreens are very good with small kids. You really shouldn't have a small child out in very intense sunlight for very long anyway. But if you're going to, trip to the beach or something like that, the titanium or zinc or aluminum products are best for children because they're not absorbed, and there's very little likelihood that a allergic reaction will occur from the metal, and usually not the vehicle that the metal is in either. Okay, let's talk about a couple of other ways we can protect our skin from the sun. So one is stay out of the sun. 2 are sunscreens. And 3 are mechanical devices, and that's hats and clothes. So having a broad brimmed hat that gives your face shade, and the upper part of your body shade, the back of your neck, the tops of your ears, your nose, the brow area, those areas that really get the direct rays of the sun if you think of it as a bird flying over, what the bird's going to see. Those areas are well protected by some type of hat with a broad brim that extends over your ears as well as out in the front. And the other are sun protective clothing products, and you can order these online all day long. They're not very expensive. And if you don't want to bother doing that, then basically just darker clothing will have a much higher sun protective effect than lighter clothing. So those are good ways to protect yourself from sun exposure. If you do have a burn and you do have changes due to chronic sun exposure, then you may be interested in a few tips for things that we can do to ameliorate, if not reverse, some of those skin changes. So what are some of the changes associated with sun damage in our skin? Well, first thing is pigment changes. Most of us can make melanin, not all of us, but most of us can darken. In other words, the melanocytes are stimulated to make increased melanin, and that's picked up by the epithelial or the skin cells, and so our skin darkens. But one of the problems is that sometimes the darkening is not even, and we can have sunspots. We can have little lentigos, they're called, which are little, they look like age spots or flat moles that are just slightly darker than the surrounding skin. We can have also blotching that occurs because the skin gets burned and then it's not burned quite evenly, or the healing is complicated by blistering, maybe a little irritation or superficial infection or scratching, that sort of thing. That can cause pigment changes, because as that skin repairs itself, what happens is that the skin becomes inflamed, and the inflammation stimulates production of melanin, because the melanin, if you think about it, the skin is producing melanin as a type of armor. It's a type of protection. So anytime the skin thinks it's being damaged or that it's vulnerable, it'll make that melanin, and as a form of self-protection. And if that melanin is not even, if it doesn't happen to aesthetically look particularly good, that can be kind of disfiguring. So that's one thing, is the pigmentation. Another is little hyperemic or blood vessel induced changes. So if you get a burn, you know that your skin gets red. That's called hyperemia, and it's from the small capillaries in the dermal subdermal plexus dilating up as a way to bring extra supplies in, extra glucose, oxygen, other cell messengers, and even stem cells into the area to repair the area because of the burn. And a sunburn is a burn like any other burn, actually, and it can be quite deep. Most of the time when we get a sunburn and we just get blistering, it's what would be considered a superficial second degree or partial thickness burn, maybe just a first degree burn, but it's a burn nonetheless. And that hyperemia is something that occurs as a consequence of the burn. But we also can get those little red spots or capillary angiomas. Those are seen very commonly in very light-skinned people, but we see them in everybody, every skin type. And they basically consist of a little nest of capillaries covered by a thin layer of epithelium. So that's why if you scratch that capillary angioma, what happens is it bleeds like nobody's business, because all that's there are capillaries. So if you do that, you're not going to bleed to death. You basically, like any other bleeding, wipe away the blood clot, hold direct pressure with something cotton, and just light pressure with a finger, and hold it for somewhere around 10 to 12 minutes without interruption, unless you have some kind of bleeding problem or you're not holding directly on where it's bleeding. Otherwise, that's going to stop. You don't want to keep looking at the area bleeding, obviously. You want to hold it so that it has a chance to clot. Other changes that happen with chronic sun exposure are loss of elasticity of the skin. There's actually a protein in the skin called elastin, and that material, as it's degraded and it's not replaced, it will cause our skin to wrinkle That with the fact that our skin thins over time, the dermis or the deeper layers of the skin will actually thin over time as we lose that collagen from our dermis. That's the layer under the epithelium. So we have more of that, and then it thins out and stretches out, and now we don't have as much elasticity, and so the muscles underneath, as they contract, the skin will fold at a right angle to the muscle. So if the muscle is going this way, the wrinkle is going to go this way. So I have muscles up here in my forehead. If I raise my forehead, the muscle's going up and down, so the lines are going to go this way. So those wrinkles occur with age normally, but they occur much more when you lose elasticity and you have increased thinning of the skin due to the sun damage. The other issue is dryness of the skin, and that's from loss of some of the skin adnexa. The skin adnexa are just little organelles or organs in the skin, like hair follicles, the sweat glands, the oily sweat glands, the watery sweat glands. When these glands stop working as well and skin gets drier, that contributes to those fine lines and wrinkles that we see. And then just naturally over time, moles or little pigmented lesions, nevi is the medical term, they will darken up more, and they will even grow faster with the stimulus of sun exposure. So those are just some of the changes. And then more advanced changes, we'll see obviously interference with the normal maturation of the skin cells, and that's what leads to what are called actinic or sun-induced disorganization of the skin cells, or actinic keratosis is the medical term. And then eventually that leads in many cases to little skin cancers, basal cell and squamous cell cancers. When that sort of thing happens to the pigment-inducing producing cells, that's called a melanoma, and those are the three major kinds of skin cancers. You have your melanomas, and then the basal cell and squamous cells. There are some others as well, like Merkel cell, different syringomas, and different little lesions, but you don't really need to worry about those 99% of the time. So that's just a little review of sun exposure, a few facts that I hope you find helpful, a few facts and tips about sunscreens that I hope you find helpful, and a little review of sun damage, what we can expect from the sun damage. And if you hang around just a little bit longer, I'll go over some of the treatments for sun damage. Okay, what are the treatments for sun damage? So it depends on what we're trying to reverse. So if we're trying to reverse the hyperpigmentation, we can use laser, which is coherent light, but most of the time we're using just intense pulse light, which is more ordinary light from a flash bulb, for example. So the flash on your camera is going to be an intense pulsed light, and if we take a light like that and make it more intense and send it through a filter, then we're going to get that sort of intense light that is only a certain range of wavelengths, a very more narrow range of wavelengths, so we can tune that to the color that we're trying to get rid of. So if we want to get rid of something that's brown in the skin, then we'll use a filter that only produces light that is in that wavelength. That'll be absorbed by the brown color, won't be absorbed by the surrounding whiter skin, and then as a result, that browner color will heat up, it'll burn it off, it turns a little darker because it absorbs that light and then flakes off after a few days. So that's how IPL, or intense pulse light devices, work. The one I own is made by a company called Sciton, S-C-I-T-O-N, which is a very good machine, I think. But there are a lot of different brands of IPL around, a lot of different lasers that can be used for this also. It's just, they're generally a little more intense and can produce a little, can produce damage when they're used at too high an intensity, basically. Chemical peels can also be used, as well as other both chemical and mechanical means to abrade and damage the skin so that we flake off the area that's hyperpigmented and produce a fresh healing layer. So as long as those things are done by experienced hands for the right indication, they can be very safe and effective. But most of the time for hyperpigmented areas, we're going to be using some type of light device, typically in most medical practices. Same thing for vascular lesions, things that are red, those things that are caused by inflammation that doesn't fade naturally in a relatively short time, or a vascular lesion like capillary angioma or even small veins. Those will be treated by some type of light producing device, either a laser or IPL machine. There's no magic machine. It's really just a tool that's used by hopefully somebody who's experienced and knowledgeable about what that particular machine can do in different clinical situations. I think it's kind of fool's errand to search after the latest, greatest machine when really it's really not that there's a special hammer. It's that the guy holding the hammer needs to know how to use the hammer, if that makes sense. Problems that are a little more difficult, like wrinkles, these can sometimes be filled with a filler. I think that fat and fat that's enhanced with your own regenerative cells is very helpful, and it's probably the best thing, as long as we don't overdo it on the replacement of volume. Fat in and of itself is a very nurturing tissue, and most of our tissues improve when we add fat to them. I agree with everybody who's saying to themselves, yes, but I've seen these people puffed up like a frog that look ridiculous because somebody injected too much fat. I agree. But fat is better than artificial filler materials, even the HA products. We're seeing increasing reports of inflammatory reactions to these products. I wouldn't dissuade you from having 1, 2, 3 cc's of these intermittently, 2, 3, 4 times a year, but people that are getting 10, 15, 20 cc's of these products, I think are putting themselves at risk for more difficult complications. They're certainly not very, very common, at least as far as we can tell, but there are increasing reports of these problems. And once you inject these materials, it's hard to get them out. It's true you can dissolve them with an enzyme, but that can be more difficult than it sounds, in my experience. So wrinkles, we can fill the tissue underneath to plump them up. Can you actually make the thin aged skin thicker? You actually can with fat, and especially stem cell enhanced fat, but that's going to be in an experimental phase at this point, and there are applications for that, but it's not something that you're going to find in every dermatology or plastic surgery office. They're going to be specialized people who've been working in that area for years. If you really are, and will be discerning in who they select as candidates for that kind of treatment. The other way to deal with these chronic wrinkles from age and excess sun damage is going to be, of course, surgery that lifts the tissue. And that can be with internal barbed sutures of different kinds, string lifts, that sort of thing, but more likely either limited or more complete facelift and neck lift, and that is a subject for a whole other video. So I will leave it at that. I hope that this little review of sunscreen, sun damage, the effects of the sun, and some of the things we can do for the effects of sun damage was helpful, and I hope you picked up some new information. If you think I left something out that's important or made a mistake, or you just have a question or want to tell me how great it was, that would be appreciated. But in any case, I do enjoy the criticism and I do enjoy the questions. Please leave them somewhere down here below and I'll get through them as soon as I can. And meanwhile, you have a wonderful day and I will carry on trying to make the world a little prettier place here in Aronowitzland.